When he was born, they put him in a cot to the left of us. And I asked the nurse, I said, what is it, a boy or a girl? She said, it's a little boy, but he's very poorly. And I said, well, can I see him? And they brought him to us, just a glimpse, and then they took him away. Why couldn't I pick him up? Why couldn't I have a photograph?
You got some silly film footage?
Got some silly film footage because they said the flash might affect him. And I didn't want to hurt him any more than he'd been hurt, so I took that.
Linda's son, Gary Lee, was born with horrific deformities, and shortly after this footage was taken, he died. The question is, was the damage caused by a drug given to Linda by her GP? Primodos was prescribed as a pregnancy test in the 1960s and 70s. We've met dozens of alleged victims who believe it could damage fetal development, sometimes fatally, or leaving children with life-changing deformities. In 1975, a warning was placed on the packet that it should no longer be used during pregnancy, but the German manufacturer Schering has always denied the drug was harmful. Recently, using a public interest request, Sky News obtained access to the National Archives in Berlin, where 7,000 documents about Primodos have been stored unseen for decades. Here, we discovered an internal review of all the correspondence about the drug, and that in January 1975, a Dr. William Inman contacted the manufacturer Schering. He was a member of the UK's Committee on Safety of Medicines and had done a study monitoring hundreds of women in the UK. He said that those who took a hormone pregnancy test had a 5-to-1 risk of giving birth to a child with malformations. Later records suggest this scientist destroyed all the material on which his investigation was based, and that he has done that to prevent individual claims being based on his material.
Why? Really, what's what we want to know? Why? The likes of me and other mums have suffered. Babies have suffered. Babies have died. Babies have been deformed. Babies have had no life.
Until now, the 5-to-1 figure has never been made public. In 1982, alleged victims were advised to drop a legal challenge against the German manufacturer as they were unlikely to win. But behind the scenes, the drug company Schering, now owned by Bayer, was not so confident of this outcome.
In these documents, we have the minutes of meetings between the company and their British lawyers. And what the lawyer tells them is that they are likely to be found guilty of a breach of duty.
Lawyers knew about the 5-to-1 risk, but were also concerned about the drug's lack of testing, and in July 1978 stated it was apparent that no toxicology had been carried out before introduction, either in Germany or in the UK.
There was clearly scientific capability, both within the industry and within the wider scientific community, to conduct teratogenicity testing of new drugs on animals before giving them to human beings. So the idea that no testing was done before humans were exposed to this drug is dreadful and shocking.
The drug was removed from the UK market in 1978, so it hasn't been tested since, until now. Sky News has gained access to a new study. Neil Vargason, an expert in embryo development, tested the compound on fish, which in early development have similarities to a human fetus. Dr. Vargason found that the drug caused a range of deformities.
And some of the problems that we found were things like enlarged hearts, changes to the yolk sac of the embryo. The yolk sac contains nutrients, so allows the embryo to grow, twisted spines. And we also have fin defects. So you see the fins here away from the body, and you can see here that they're damaged and they're facing along the length of the body.
It doesn't sound like the kind of thing that you would in current day give to a pregnant woman.
No, not at all. This is a very high dose of a progestogen, which is progesterone based. From the stuff we've seen with the fish, it's doing something to the embryo if you add it directly. This is a fish, so we have to be careful how you extrapolate that to a human, but the potential is there, and I personally would like to see more research done.
Bayer declined an interview but has told us Primodos was on the market in the UK in compliance with prevailing laws. The view at the time and today, after a full review, is that evidence for a causal association between the use of hormonal pregnancy tests and an increased incidence of congenital malformations was extremely weak. Shearing's legal advice was from a QC who did not examine scientific evidence, and legal action was terminated in 1982 without any court procedure. They reject any suggestion that anything has been concealed by Shearing other than privileged documents.
I've been asking myself, why did I take these tablets? But them days, if the doctor said the moon was great, made of green cheese, you believed the doctor. These days I wouldn't, but them days I did.
Based on what we've uncovered, parents like Linda are more convinced than ever that these pregnancy tests destroyed lives. Jason Farrell, Sky News.
Well, you can see Jason's documentary Primodos, the secret drug scandal, on Tuesday night on Sky Atlantic at 8 p.m, or you can catch it here on Sky News on Wednesday at 9 p.m.